At a recent Senate hearing on healthcare, Senator Patty Murray questioned William Feldman, physician and health policy researcher at UCLA, about the growing concern that millions of Americans could lose their health insurance as the ACA premiums become increasingly unaffordable.
We're talking about 5 million Americans becoming uninsured because of this failure to extend the ACA premium tax credits. When people become uninsured, what do you see as a physician that patients skip out on, and what does it mean for their health?
What I see is that patients skip out on doctor's visits, patients skip out on medications. I vividly remember seeing a patient in the ICU last year who was there in diabetic ketoacidosis, DKA, which can be a fatal complication of diabetes. Why? Because she couldn't afford her insulin. So I think people losing their insurance will have very real consequences for patients across this country.
Yeah, I talked to some providers in a very rural part of my state a week and a half ago, talking about with all this uninsured that they will see, especially in our rural communities, it is going to have a real impact on providers, on hospitals and doctors, and we're going to see more of them not be able to provide the care they need because that they get the care eventually, but usually when it's more expensive, and they provide it uncompensated. So I wanted to ask you, as a physician and a researcher, what happens to our safety net providers and hospitals when Americans go uninsured, from your perspective?
The safety net providers get stretched. When patients don't have insurance, hospitals, community health centers are providing more care without reimbursement, and it only makes their jobs that much harder.
Yeah. Thank you. Thank you very much, Mr. Chairman.
For more congressional news, stay tuned to Congress Clips, and thanks for watching.